Hi, welcome to this lecture on wound healing. It's a fascinating topic and really relevant for anybody going into the healthcare profession, especially the nurses and the PAs. Um, when we're talking about wound healing, what we're talking about is what is happening physiologically that allows the body to replace damaged tissue and to hopefully restore it to its prior functionality. Now, replacement is not the same thing as restoring, as we will find out shortly, but hopefully we can get as close to the original as possible. And this requires a lot of activity from a lot of different cells. So as I go along the steps, I'll be talking specifically about what different cells do at different times. And as well, there's going to be chemokines being released. And we also have physical things as far as what's the oxygenation level of the patient, what's the blood supply of the patient, what's going on with stress and tension on the wounds. And so all of these things are going to help determine whether we are going to end up with tissue regeneration or tissue repair. And mostly we're going to be talking about tissue repair today because tissue regeneration has a very narrow applicable field. And by tissue regeneration, what we mean is the body is going to replace cells that were damaged by identical cells. And so they're going to have exactly the same function as before, and they're going to look exactly the same as it did before the injury. Now, the body is very limited in the cells that it can regenerate. Hepatocytes are one, but the biggie are going to be your epithelial cells. So this applies not only to the epithelium of your skin, your epidermis, but especially the epithelium of your respiratory and digestive tracts. For instance, areas of our digestive tract, the epithelium gets replaced about every 5 to 7 days. And so it's a normal process that goes along without any injury, that you're losing these cells and replacing them with identical cells. Okay. Now, in contrast to tissue regeneration, what we're going to be mostly focusing on today. Oh, and by the way, so tissue regeneration only going to happen for minor damage. And because it looks exactly the same, you have to realize there's no scar tissue, and so there's no permanent damage. So hopefully I made those points clear. All right, so now we'll compare that with tissue repair. And for tissue repair, we're talking going below the epithelium. So in the skin, we're going to be talking about dermis, subcutaneous tissue, and other organ systems, we'll be talking about submucosa. And even mucosa if need, and even muscularis levels if the damage goes that deep. So when we're repairing the tissue, we're going to be putting different cell types in there than were there previously. So we're going to be losing some of the specialized function. For instance, if we put a scar in the middle of muscle that was contracting, and we put collagen fibers there, well, those collagen fibers aren't going to contract like smooth muscle used to contract. And so we're going to be losing the functionality a bit. And this tissue repair, obviously, we're not just relying on some stem cell to make the exact same cell it was before. Now it's going to be a lot more complicated. We're going to have a lot more cells involved. And so we're going to end up with some scarring at the end and a difference in appearance. But the advantage of this is going to be able to replace a serious injury, whether it's from a surgeon at an operation or whether it's from an accident. And some of the original structures may be replaced and have the same functionality, but other structures may not be replaced identically. They may be replaced with some abnormalities that are going to impair the function. But what all of this is going to have in common is for this tissue repair to occur, we're going to need an adequate blood supply and adequate nutrients to go to the area. So if you have poor oxygenation, if you have poor perfusion, tissue repair, if it happens at all, is going to be a long, drawn out process with many ups and downs, hills and valleys in the repair process. So when we look at the stages of wound healing, there's a set sequence of events. Just like when we talked about when you break a bone, these are the steps that happen elsewhere. Well, when you create a wound, and yes, the picture on your left is a surgical wound, something was excised. And for a lot of this, we're going to be showing pictures of skin just because we can show wounds healing at different stages. It's hard to get pictures of organ systems wound healing over different stages because we tend not to go back and reopen people to see the previous stages of wound healing. So that's why you're going to be seeing skin pictures mostly. So we have 4 distinct steps: hemostasis, followed by inflammation, followed by proliferation, followed by remodeling. Okay. And although we say you go from A to B to C to D, you have to realize life can intervene. There could be a crisis. There could be a lack of perfusion or a lack of oxygen or a lack of nutrients, or there could be an infection, or there could be stress or whatever. And so you can work backwards. So depending on the circumstances, both internally and externally to the patient, because maybe you get another trauma to the same area. You may continue in a linear fashion as you were kind of used to in your youth, or you may not, as is more common when you are elderly. So before we talk about how we're going to repair injured tissue, let me talk about uninjured epithelium, whether it's in an organ system or a skin. We're going to have macrophages. So where are these macrophages coming from? Well, as you know, macrophages are going to be coming from monocytes, which are made in the red bone marrow. And from the red bone marrow, they go into the bloodstream and they're cruising along, and capillaries cruising along to see if there's any local damage on the internal epithelium of the blood vessel. And periodically, they're going to leave the blood vessel via diapedesis, especially at a site of injury. Now, if there's no injury, some of them still are going to undergo diapedesis and show up in the local interstitial tissue. Those that are in the tissue they can spread out, but they'll tend to be closer to the blood vessels. And so if you recall when you learned about skin and anatomy, because this basically is a picture of skin, a stylized drawing of skin, you'd have to change the epithelium from a stratified squamous to a columnar type if you wanted to put it in the GI tract, for example. Remember that the epithelium is not vascular. There's no blood vessels there. Okay, so it's going to be relying on nutrition, nutrients, and cells coming from the submucosa or from the dermis or the hypodermis in the skin. And so we're looking at the skin. What you'll notice is most of the macrophages, because that's what you call a monocyte that's in tissue, most of the macrophages are going to be fairly close to blood vessels. That's where they came from. And they're going to be monitoring for possible antigens, or there's a pathogen, did something happen and go into that area. And so with that, we are done with this first section. I'll see you shortly when we learn about hemostasis.